Hello, my name is Lawrence Gold, and I'm the developer of this program. I'll be demonstrating and I'll be your guide through this program, which will enable you to replicate for yourself what I have done for myself and others have done for themselves. What you have in hand is a program of guided instruction by which you'll be able to recover control of the muscles of biting and chewing that have kept your jaws clenched and made you subject to things like teeth grinding, tension headaches, and earaches. What you'll be learning in this program is control of the movements of the jaws in their basic three directions of movement, which are opening and closing, side-to-side movements as in grinding, and forward-to-back movements, which are involved in opening your jaws to their fullest extent. Each of these movements will refresh your control of those movements and muscles so that you have freedom of movement and a naturally normalized degree of muscle tone in those muscles of biting and chewing. This will enable you to bypass any need for mouth guards, surgery to the teeth to adjust the tooth surfaces, or other means by which people hopefully get rid of TMJ dysfunction. You'll find that this rather simple and direct approach cuts right to the center of what's going on with TMJ dysfunction and produces rather rapid improvements in jaw movement function. I'll be guiding you through a series of organized movement patterns that address the basic directions of movement of the jaws, which is opening and closing, side-to-side movements, and front-to-back movements. Now, of necessity, we'll also be addressing the muscles at the base of the head, at the back of the neck, which are instrumental in the head movements that you use, for example, in biting an apple, where you bring your head forward enough to be able to open your jaws to meet that apple with your teeth. You see, control of the jaws is not just in the muscles of the jaws, but also in the muscles of the neck. And so these movement actions that you'll be learning will incorporate jaw muscle control and neck muscle control. Now, what's going to happen in these movement exercises is you're going to recover control over the involuntary or habitual jaw tension which has created the symptoms you've been suffering of TMJ dysfunction.
Do I have to start again? Yeah, start again. Paul, look at me, look at me. You better still be rolling, buddy, or there's going to be trouble. Okay. This next sequence, well, let me ask the group as a whole. How many of you really don't like taking your head and neck into extension? Now be honest. Only one? You're lying. Okay, there's 3, 4. No, there's many more than that. I want to show you through this jaw and face exercise sequence just why it is that people don't like to take their heads and necks back. Basically, it feels insecure firstly, and secondly it hurts. That's why people don't like to do it. So the first test is how wide can you open your mouth. So we want, according to Travell and Simons, I'm quoting the great Travell and Simons now, we need to be able to fit 3 knuckles in between upper and lower jaw. So watch. Minimum flexibility. Now, we were doing this on one workshop once, and this girl, I can't remember whether she was tall or short, I can't remember, she put a whole fist in her mouth. This fist just disappeared into her mouth, and everyone just looked shocked. But she had very, very flexible jaw muscles. That's the point. So what we want to do, did you feel when you opened your mouth wide, could you feel what was actually restricting you there? So watch this sequence, please. And we're going to do this now. We are going to stretch the muscles, which these muscles here, the jaw muscles, very powerful muscles with extremely good leverage. I think human jaws can generate 400 or 500 pounds per square inch, or it might be even higher. Anyway, lots of force. And people who grind their teeth at night time, is it bruxellosis? Bruxism, thank you. Bruxellosis is some cattle disease, I think, from them anyway. If you do grind your teeth, these exercises are immensely helpful. Okay, so sit up straight, everyone, please. Now watch me do it first before doing it. So this is a Simon Says thing. Wait for me to tell you, please. So you open your mouth wide. Uh-huh. 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 So let me add some words to that. We open the mouth as wide as possible. You put 2 fingers of each hand on the lower jaw. You apply a gentle biting force to your fingers and don't let your fingers move. Then take a breath in, and on a breath out, very carefully draw the jaw down. Now listen, be aware. This joint here, the temporomandibular joint, is an extremely small joint. If you look at a skeleton, it will shock you, am I right? It's about the size of your little fingernail. It's very small. What's more, it's a gliding, sliding joint. And so the resultant force and what you experience as pain or tension at this joint here is nothing more than the sum of the forces of all the muscles we're going to stretch in the next few minutes. You want them soft and relaxed. Okay, so open the mouth wide, everyone, please. Place the fingers on the bottom jaw and take the jaw down a little bit further. Your fingers will allow the jaw to come down a bit further. Can everyone feel that? And then once you're in that second position, apply a biting force to the fingers, but do not let the fingers move. 3, 2, 1, stop. Now, having done that, take a breath in. And gently draw the jaw down and keep it down. Do it slowly, please. And feel the immense sensation in this area here. Keep going down, Bindu. Further down. Breathe and relax. Okay? Then stop that. Bring the jaw back to its normal position. Open the mouth wide again. And normal position and relax. Wait, we'll get there, Jack. We'll get there. Now the next action that I'd like you to practice is protraction, pushing the jaw forward. So, Paul, I'm just going to turn side on, so you might want to reframe on this. It's like this with the teeth separated, everything nice and straight, and then watch. Pushing the jaw forward. And again, do this slowly, please. You'll feel this is a completely different set of muscles that move the jaw forward. So, and relax. And now retraction, the opposite direction. So, I'll turn side on again, Paul, so that you can frame on this. It's bringing the jaw straight back. So, and feel that up in here and feel that inside the mouth. And then, last of all, sideways movements, but not casually, done slowly and put a little bit of effort into it. So I'm talking about this. And back to neutral and like so many of our exercises, can you feel there's a difference between left and right, going left and going right? You're starting to identify these fundamental jaw tension patterns. Can't hardly go. And the other way. When you watch a room full of people practicing these exercises, it does look as though we've been hitting the alcohol just a bit hard. So just quickly to go through them again, it's I did 2 little contractions then, and then protraction, retraction, sideways, sideways, and now, Jack. Any easier? Okay, now this is just a setup for experiencing the sensation of taking the head and neck backwards. But before we do that, let's do a neck rotation exercise, because as I've mentioned elsewhere many times, if you have anybody in your class who claims they have a neck problem, and who may indeed have a neck problem, the safest and most indirect way into helping someone with neck tension, if it's assuming that the neck problem is a result of neck tension, is simply to encourage them to turn their head further. And we do it like this, remember. Just let your hands rest lightly on your knees. Sit up nice and straight. Now, straight here is not an aesthetic thing. It's trying to make the spine as long as possible. As in all of our rotations, we're trying to distribute the load over as many vertebrae as we can rather than just a few. Do you remember that from the seated rotation? So like this, everyone turn their head to the left and go as far as possible until you come to that barrier. Stop, let your shoulders drop down, take a breath in, and on a breath out, turn the head further. Again, let the shoulders drop, take another breath in, and turn the head further in the same direction. Try not to move your shoulders, then come back to the